Hi, everyone. Welcome back to the Social Work Bubble podcast. I'm your host, Laura. Today, we are joined by Liz, a fellow LMSW, a cognitive rehab specialist. We'll be talking all about her experience in cognitive rehab, skills that we can use, why it's so important, everything in between. Thank you so much, Liz, for coming on today.
Thank you. Thank you for having me.
Of course. Now, before we get started, can you introduce yourself to the listeners and kind of your journey in social work?
Yeah. Hi, my name's Liz. So I started off as a school psychologist in the New York City DOE, and I did that for several years. I eventually looked for a job after school for a little bit of income.
Mhm.
And I ended up doing psychometric evaluations at a neuropsych office. So while I was there, that's when I was introduced to cognitive rehabilitation therapy, sometimes called like cognitive remediation. And I really became intrigued by how the brain worked and all its like regenerative qualities as I was learning about traumatic brain injury and our brains and our functioning. And I just ended up deciding to go back to social work school because I wanted to work more with individuals and also because TBI, what I learned in my time there is an invisible injury and a lot of advocacy needs to be done. And I thought
Mhm.
social work would be a good fit. Not only can I help
That's right.
individuals with treatment, right? Psychotherapy, but then I could also help on like a macro level. I can go and like actually change the system and change the
Hmm.
rules and help these clients access resources and also just get better treatment overall. Because what I observed was a lot of times someone survived a brain injury, they would get a lot of like, it would take more of a medical approach and they
Hmm.
would sort of go see doctors for like their headaches and things like that, and symptoms were being treated with medicine. Sometimes they get speech and language, occupational therapy, physical therapy, but no one was treating the brain. And
Which is so crazy when you
yeah,
say it like that.
yeah, and it's like it's a brain injury, we need to
Hmm.
also help rehabilitate that, not just medically, right? We
Hmm.
know that we can do it with other means. And
Hmm.
so that's why I was like, social work would be a good route for me because there aren't very many social workers that do this. And because social workers can work in an individual level or they can go and change laws. And I was like,
Hmm.
that's what needs to be done at the end of the day.
We love that.
Yeah.
God. I like that too, because I think so often we think as like social workers in hospitals it is that typical medical social work route where I think it can be very referral based or just like making connections for when they leave. But this is very much like you are doing work and really changing the brain and seeing progress happen.
Absolutely. And I really think that it's a very new type of approach
Hmm.
that, because of the recent imaging and science that has really flourished within, I would say, the past 25 years, this approach began. Because before we couldn't really see the difference in the brain and see that neural growth that comes along with
Hmm.
cognitive rehab. So now we can actually see that it's productive and it is successful. So I think
Yeah.
that's and the great thing is that now as social workers and doing a podcast like this, it's exposing us to a new thing
Woohoo!
we can do, brain health, which I think is really coming along
Hmm.
in our times that everyone's looking at how can we like make our brains stronger.
Very true. I feel like I hear that, especially in like pop psychology, like
Yes.
strengthen your brain, like, do all this. And I mean, there's tools that actually exist that are really helpful.
Yeah,
Mm.
absolutely.
Now, we've used the term cognitive rehab. What does that actually mean? What is that?
So, cognitive rehab can be a treatment approach. It takes two different types of sort of methods. The first part is more your learning strategies. So, memory strategies using alarms, notebooks, mnemonics, self cueing, or coaching to
Hmm.
help the brain sort of accommodate for the deficits that were created because of the injury.
Hmm.
Or there's also, this is the magic, I feel, the restorative treatment. So, what we have found through neuroscience is that there is neuroplasticity, which is that our brain changes. It
Hmm.
evolves based on the exposure that we have. And neurogenesis happens. So that's the magic. That's what really is amazing. It is
Hmm.
when our neurons actually grow new synaptic connections. They grow new pathways based on practicing exercises. Just like you're
Hmm.
going to the gym and you're pumping iron and you're going to get your muscles, you're going to be toned, you're going to look like Miley Cyrus
Hmm.
at the Grammys. You can do that to your brain. You can actually grow those neural connections, those pathways, and
Hmm.
you will become more what we call automatic or efficient at those
Hmm.
functions, which will overall change your, memory skills if that's what you're working on, if that's what the exercise is
Hmm.
trying to help or produce or, enhance.
Right. That's so interesting because I do feel like I've had clients come to me, and I think this is just like a lack of information where they don't realize if we can actually change your brain, like stuff happens. There is like a change that happens where they think, oh, well, we're just talking about things or we're just learning this skill. They don't really realize that their brain is actually taking that and, like you said, neurons are changing and growing. It's crazy stuff.
So I think that is where social workers and when we are looking at our own treatment, when we're, giving psychotherapy, that's something that we have to start like incorporating into our treatment. And even I
Definitely.
feel like in schools, we're not really taught much about it. We talk a little bit
Yeah.
about neuroscience in some of our courses, but it's not really, we're not exposed to it as much.
Yeah.
But what we found with, obviously science is that any learning, like children when they're learning, and
Mhm.
when we think of young children, right, they're creating all of those neural connections. That continues to happen throughout our life. Now, when we
Mm.
have trauma, it decreases, right? Those neural connections kind of diminish. So we
Mm.
found that. But when we can kind of enhance those skills, we can reconnect or rewire our brain. If you practice good coping skills, exercises, you
Mhm.
use those accommodation or strategies to help you, and the neural connections kind of flourish.
Magic, like you said.
Like I said, and it really is, and you can see them on imagery like
Mhm.
MRIs and things like that. So it's amazing.
Wow. Now, you've mentioned like people with a TBI, like that's a big part of the work there is working with people that have a traumatic brain injury. Who else is this good for? Like who is your typical client you're working with?
So I do work with individuals that have TBI, and so that's kind of a broad spectrum as well. So a
Hmm.
person with a traumatic brain injury can be someone that has experienced like a stroke, exposure to toxins, oxygen deprivation, infectious
Hmm.
disease, or head trauma, or someone that was in a
Yeah.
motor vehicle accident. I also work with the elderly population
Mm.
because naturally all of us over time will have degeneration, right? So
Yeah.
we know that our neurons, we are going to decrease in capacity, or those neural pathways are going to weaken as we age. Naturally, everybody has that. That's why we don't have as acute eyesight and our hearing
Mm.
goes away and we, have weaker motor skills. But I think working with the older population and teaching them these exercise can help them at least maintain many of their skills for a prolonged period of time.
Mm. Very true. This reminds me, I don't actually know if you would know this because it's more about like dementia, but I remember watching a TED Talk and this woman was basically saying like I'm kind of preparing for when I get dementia because it was so heavily like genetically in her family. And she was doing activities like this to like help strengthen her brain almost in preparation for when eventually that would happen to her.
Yeah, so I do have a few clients that, yes, hereditary wise, will probably have dementia at some point in their
Mhm.
life. And they do have these cognitive rehab exercises that they complete with me as a preventative measure to
Mm.
maintain their skills, or individuals that already have the diagnosis and they
Yeah.
come in and they just want to kind of push back that timeline for when they have more severe symptoms. And they
Hmm.
can, because they're able to exercise their ability, memory ability, speech and language,
Hmm.
spatial reasoning, etc.
Right. That's so That's just so cool because I feel like with stuff like that, it can be so hard to deal with like a medical condition and to have to cope with that. So to feel like you have some semblance of control and power in your experience and can see change is so encouraging.
I definitely think that is one of the benefits of cognitive rehab. It gives hope.
Mhm.
It gives hope to individuals that might feel that, like, because they have a cognitive deficit, because maybe they're not speaking like others or they can't
Mm,
remember as much information. And obviously, in society, when you're not able to function as quickly or as fast or as um, present yourself well in society, you often feel like you're being judged. But this
mm,
gives hope to those individuals that they're actually able to regain at least some of their functioning, maybe not 100%, 80%, 90%,
mhm.
and they can, just live a better life.
Yeah, absolutely. What are some of these like cognitive skills, and what are they targeting, I guess?
Yeah.
That's a way to say it.
So typically, what we would do at the beginning of in a neuropsych setting, but
Yeah.
definitely as social workers, we do have testing results, if it's a child or if they have previous neuropsych testing or, an IEP or whatnot.
Mm,
Um, we look at the different types of functioning. So one is memory. So if you have a client that has a memory deficit, they're having a poor time recalling information, whether it's
mm,
auditory or verbal, you would have them practice exercises exactly like that. So for example, if somebody has poor recall of word, which is like verbal retrieval skills, you would have them identify categories, you would have them
mm,
identify different words or, synonyms, different exercises that really focus on going into your brain and
mm,
pulling out those words. And the more that you do that, you're going to see there's neural growth in that part of your brain where there's speech and language and where there's verbal retrieval will actually become stronger in the
mm.
most simplistic way. So they
Right.
the other functions that also are worked on in cognitive rehab are like spatial reasoning, which we need when we're
Mm,
like driving, we're constructing things, we're mentally rotating items. We also have other skills like processing speed and reaction time. We need that every single day. How
mm,
quickly your brain takes in information and your body reacts to it. That's another skill that we work on in cognitive rehab. I'm trying to think too. I
mm.
think, yeah, those are probably the top three.
Wow. Wow. I'm blown away by this. I love this. Because it's also, I mean, this is making me think of clients that I work with that have trauma, like that come in with like PTSD or something, and how we so quickly jump to like the emotional side of it when it's just like, hold up, there could be a brain injury happening, like, and why it's so important to get that thorough history and to really see a client fully because we have no idea what could be impacting how they're showing up.
Yeah, I definitely think that this podcast and us having this discussion will be helpful in helping social workers think about this when we are doing our intakes because it's a question that's often left off of the intake forms. We often
Mhm.
find out about medication and maybe their history, but we never say, have you ever had a brain, like, have you ever had a injury? Have you ever hit your head? Have you
Mhm.
ever, had like a mini stroke or anything like that? And sometimes clients forget to mention that in their medical
Yeah.
history. And those are all factors. We've also seen that, long term trauma can cause those neural connections to weaken and
Hmm.
ultimately making your behavior or function less. So
Hmm.
it's something to factor in if we see a person with chronic trauma to think about, okay, perhaps they have some degeneration and them doing cognitive exercises could enhance their skills over time and then thus make them cope better or
Hmm.
make the coping mechanism that we're trying to teach, more enhanced.
Right. That's very true, because how can we expect a client to like learn a coping skill if also they're like cognitively not in the space to hold on to it?
Yeah.
Hmm.
Yeah. So it's always
Interesting.
thinking about, like, is their brain healthy enough to receive this information? Because
Hmm.
we don't often look at that. look at our work through that lens. We look at it from like the social, emotional, environmental components.
Yeah, that's very true. Wow. I just feel like we need to overhaul everything that we're doing now
Well, I
to
think,
incorporate
it's
this.
newer science, and I think this is where the conversations all start. And talking
Mhm.
about brain health, why it's really being presented now is because we actually can measure it in some capacity
Yeah.
versus years ago we couldn't, so it wasn't a part of our treatment plan.
Hmm. Very true. I have seen, I think a while ago, I had like a few clients right in a row just talk to me about like the brain scans because I feel like at least on the internet there was this whole period where people were like, "Oh my gosh, like this is what a depression brain looks like.
Brain,
This is
oh
what an
yeah, I
ADHD brain looks like."
I
And so it
remember.
really has brought a lot of awareness to what's actually happening for people.
Yeah. So I think that's one factor we have to sort of digest and bring into our treatment approach is
Mhm.
considering the person's brain health and their current cognitive strengths and weaknesses and how
Mhm.
we can enhance their weaknesses and help them just foster better functioning.
Yeah. Do you feel like social workers would be able to do some of these skills with their clients, or can they would they refer to a cognitive specialist like yourself?
You don't necessarily have to refer to a cognitive specialist. So there are various online programs that you
Mm-hmm.
can use. There are some more well-known names than others that are, I'm certainly sure most people see commercials for them that you could, recommend for your client to do. And they do assessments on those programs and you can help them use that skill. But really just thinking about what the client's cognitive deficit is and helping them practice it, that's
Hmm.
cognitive rehab really in some.
Oh,
They're going to have
amazing.
neural growth. So if you see a client is having speech and language difficulties, you, yes, can refer them to a speech and language therapist, but also teaching them communication skills will
Mm,
enhance that skill over time, or helping them practice it in real life as a social worker will create that neural growth.
mm.
So
I love
everyone
that.
could do it.
It's so accessible.
It's not, yeah, it's accessible, and it's not necessary. It's more of a like sort of mindset and frame or approach to how we're going to look at our clients and how we're going to set up our treatment versus like a
Mhm.
specialty where you have to be specifically trained. It's just looking from the lens of like, what is that person's deficits? How can
Mhm.
they, just enhance their spatial skills, memory skills, and what
Mhm.
learning can I give them in
Yeah,
my therapy session?
yeah. I love that too because sometimes I think we can get into the space where there can be too many referrals, where I'm just like, I wouldn't go to see all these people.
In a week,
It's
right?
crazy. So being able to just have like a few skills that we can give clients and be like, okay, like you can just keep practicing these, focus on this, and you can see the growth that you're wanting to see.
And it's
Mm.
something that they can do on their own as well, and that they can come back. You can look at sort of, if you do look at the workbooks, there are Amazon books available as well for cognitive rehab that you can Google. And you can measure it, but they can go out and practice it every day and then hopefully generalize it into everyday life, right?
Mm.
So use their memory skills not only on these activities that you're going to get, but the real goal is okay, when you go to the grocery store, do you remember all six items that
Mm.
and did you use one of your strategies, or were you just able to memorize it because there was new neural growth and now your memory
Mhm.
skills are just functioning at a higher capacity?
Right. Like normal stuff that I hear, like so many of the people I work with talk about, like maybe having those memory issues or something. And because I didn't know this existed, I'm just like, okay, like I don't know what to do with it. So to know that this is a skill that I can actually provide to people is so helpful.
Yeah. And also remember, part of cognitive rehab is thinking about strategies that you can use to accommodate for deficits, right?
Mm.
So using alarms, if you're getting lost with time, using an alarm to stop you,
Mhm.
or have using an alarm to initiate a task, stop and go task. Or taking breaks is another
Mhm.
accommodation that could be helpful that we could help teach our clients to do if they're having, you know, a difficult time managing their stress and it's preventing them from remembering information at work
Mhm.
because they're so stressed out, that they can't focus, they can't remember information.
Right. In your experience, in your role, what have been some of the biggest challenges that you've had to work through or face?
So, like I said before, TBI is considered an invisible injury because you
Hmm.
cannot physically see any damage. And a lot of my clients tend to appear to be fine. They may
Hmm.
be suffering in pain, they may be having severe headaches, they may have fogginess or other ailments because of their brain injury, but it's not seen on their bodies, right? You
Hmm.
don't see that they're struggling. So a lot of times their family members, colleagues, society sometimes
Hmm.
struggle to kind of understand that this person isn't functioning at their best during that time. And I think my role and the social work part of me is
Hmm.
helping them advocate for themselves and teach others about what they're going through,
Hmm.
and also creating those boundaries with family members that might push them beyond their limits or ability
Hmm.
during that time. I think the other part of social work that really benefits me with doing cognitive rehab is helping my clients just overall feel better about being different, but others not seeing them that way,
Hmm.
or feeling that they're different, and
Hmm.
others not seeing the difference in their abilities because they look like how they did before they had the injury. And
Yeah.
so everyone thinks they're perfectly okay. But
Hmm.
they've had such a massive, huge life experience that they're changed and nobody else really registers it, or a lot of people don't
Hmm.
register it in their own life, and it can be very painful and it can be a grieving process for them, and I think social work really helps them kind of pass through that.
Yeah. Especially that education piece. It reminds me of just like mental health stigma. Like that
Exactly.
same thing of like invisibility that's there where it's like we're struggling, and just nobody's able to really see that or understand it.
Yeah.
Mhm.
And there are co-occurring other disorders that happen with a TBI. Obviously heightened symptoms of depression and anxiety occurs
Mhm.
because you're sort of struggling with this massive weight on your shoulders and others may not understand it, or you went through this life experience that took you out of the world. That's another challenge I do see too, with my clients, is that they probably spent a whole year, if not more, withdrawn from society because their injury had
Uh,
them be in the hospital. Other forms of rehabilitation like PT or speech and language, they have lost their work, which is often a part of someone's
mhm.
identity. Maybe they lost their home because of financial difficulties, um, and things like that. And so I see that they often just sort of don't know how to reacclimate to the world,
Yeah.
start to integrate back into society, and they really have a lot of hesitation and fear to do so.
Hmm. Understandable, especially if people don't get
Yeah.
it.
Have you been got I mean, everyone had some trouble during the after the pandemic, right?
Hmm. Very
Yeah.
true. Wow. Okay.
And
What
they
are some
feel
of the, I guess, like most frequent skills that you use with clients?
So the most frequent skills that I teach in cognitive rehab are short and long-term memory skills. So I will teach both strategies of how to memorize information as well as give them different tasks where they have to either immediately tell me the information, so that's going to practice the short-term memory, or
Hmm.
there's a delay in time, so maybe 10, 20, 30 minutes later, I'm going to have them recall that information, which works on the long-term memory skills. And the
Ah.
other skills that I practice a lot because we need this in order to build all other skills is processing speed and reaction time. So those
Mhm.
are computerized programs that we purchase through various resources, and the person sits on the computer and they quickly like will react to different stimuli, visual
Mhm.
stimuli, or they will react like auditorily to the stimuli. And
Mm.
so those are the top three. So it's always like memory, both short term, long term, processing speed, and then reaction time.
Okay. I feel like that really is such a good middle ground between your psychology background and social work.
Yeah, exactly.
Interesting.
So it was the testing, like I said, that brought
Hmm.
me in. I saw all these individuals that I would unfortunately have to say, like, oh, these are all your deficits based on the testing. And then I was like, what can I do? Help. I don't want to just see bad news.
Right. Oh my gosh. Okay. Now for people listening, what would you recommend as kind of take home skills that they can potentially incorporate into their practice?
So I definitely think that we should, when we're doing intakes, try to have more questions where we can suss out or assess if that individual has had a previous traumatic brain injury
Hmm.
before. And then I think when we are setting up our treatment plan, try to have a goal that revolves around getting our brains healthier through
Hmm.
practicing a function. Now, a great resource I think most people can use, it's a free resource, is the Brain Injury Association website. So it's the biausa.org website. They have education and webinars on there for both clinicians, also clients,
Hmm.
caregivers, that you can go and you can learn different skills for free. So it's wonderful
Oh,
to
that's
go there. And
great.
they also have more information on cognitive rehab. It's specifically what it is. And, I think just educating ourselves, therefore, we can educate our clients on this. So they're also aware. And maybe after they leave the intake, they're like, oh my God, when I played sports in high school, I did have 3 concussions. Perhaps that's why
Oh
I
my
struggled in
gosh.
college. These things happen and they don't think
Mhm.
about it. And then when they're delivering the message of like, it's so long ago, but I've been struggling. And then they're like, okay, well,
Mm.
let's assess this more and get you where you need to go.
Yeah.
But taking that
Wow.
approach as a social worker, thinking about our brain health as a part of our intake and assessment and treatment plan. How can
Mhm.
we get the brain healthier?
Yeah. Wonderful. Are there any things, I'm thinking about this now, like, so we have these skills to promote brain health. Is there anything that we want to avoid that would like negatively affect brain health
Well, I think
other than being concussed?
no, to avoid for brain health, we have to also understand that it's a slow process
Hmm.
and that with injuries, sometimes going too quickly or forcing the brain to overload can be detrimental. So, pacing
Okay.
oneself, both as a clinician and encouraging our clients to do so as well, is important because I've seen a lot of clients kind of take on too much and try to just hit the ground running and they come back not re-injured but just regressing a little bit, and then
Sure.
also having lower self-esteem because they didn't accomplish as much as they thought they would because
Hmm.
they didn't pace themselves, because neural growth doesn't happen overnight. It is a long process and it's slow. So
Hmm.
we just want to kind of have hope and faith and keep pushing and be resilient, but understand that it is, you got to trust the process.
Mm. That's such an important message for both clients and
For
other
everything.
clinicians, because
Yeah.
I do think we get lost in the sauce of it all, where it's like, oh, we got to be making progress. We got to see
Let's
this and this and
measure
this. We
it.
have to
Yeah.
have breakthroughs.
Yeah.
It's
And we
too
want
much.
that, right? But
Mhm.
sometimes it doesn't happen. And then instantaneously, months or weeks later, it's like everything just kind of comes together. And like,
Yeah. I mean, it's like lifting 100 pounds when you haven't been lifting weights in 5 years. You're not gonna do it.
that's exactly it. The same thing. Yeah. I always use this, like when I do cognitive rehab, I'm always like, it's your brain gym.
I love that.
And so, like, we're going to start off slow. And a lot of times they're like, this is for babies, or like, this is, I can do this. And I'm like, okay, but you start off at the gym with 5 pound weights
Yeah.
first, and then you increase. Like, we're not going, we're not doing
Hmm.
200-pound weights right now.
Absolutely. Yeah. We probably need that confidence boost at the beginning anyways to be like, oh, I got it. Okay. Wonderful. Any final advice for social workers listening?
I think for social workers, let's start incorporating this into our treatment and educating ourselves and educating
Mhm.
others, and starting to think about how we can help our clients just have the healthiest brain. So, we're looking at their emotional health, their social health, their physical health, and now their brain.
Woohoo! I love
Woo!
it. Thank you so much, Liz, for coming on. Where can the people listening keep up with you?
You can go to my Instagram, which is therapist Liz Ramdas. on Instagram or at my website at nswny.com.
Fabulous. All that will be linked below for those listening so you can keep up with Liz. And thank you so much for coming on today. We will see you next time.